right now there's a lot of conversation about rural health transformation. We know there's a $50 billion fund set up for that. And with that, there's a lot of questions about how this will be used and so forth. And part of that is, using it for technology and using it for mobile health. How do each of your partnerships, if you will, see how you might be able to harness some of the power of those funds as you see it, and where might mobility and technology help not augment or replace, but to enhance what you're doing? Does anyone care to chime in on that one? Kurt?
I'll start. Believe it or not, between the three organizations that we have, between Knife River Care Center, Coal Country Community Health Center, and Skakwe Medical Center, we have over 400 different software that our shared IT department take care of. Out of those 400, we have over 140 of them that are exactly the same software, but three different licenses because we are three different entities. That sets us up to where we're vulnerable from a cybersecurity, sets us up from trying to maintain all the software. We have three separate server clusters in three different areas. So one of the things that we are looking at with the Rural Transformation Fund is, and believe it or not, Coal Country Community Health Center and Skakwe Medical Center are all on the same Community Connect Epic through a larger center, but they're separate. So we can see things that go back and forth, but in our critical access hospital, we do have Coal Country Clinic in there, and we provide the lab and radiology services. Our patients get to register twice because we're on two different epics. So part of this is, how do we get to one GL software, one UKG HR, because we're all on three UKG HRs, getting to get one epic so we can have better care coordination between that. And if we had one epic, we can actually interface point click care, which is the long-term care software, into that, which will help with coordination of care. And how do we reduce our vulnerability in terms of cybersecurity and service clusters? Our service clusters run probably about $180,000 a piece. We believe if we do this, we can get to one service cluster and a cloud base, which is right there, a huge savings. But at the end of the day, how do we make this seamless to the patient, but yet how do we meet, the three separate entities?
You just made I don't know, did anyone else get a headache listening to that IT scenario? Oh my gosh. All right. Here's another question for everybody, whoever would like to chime in. It has to do with community engagement. You are doing so many things for your community. And so often I find it to be, you could put it out there, but people don't understand it. Let's talk about community engagement in terms of how you're able to get community influencers and others behind you, your schools, your faith-based organizations, any manufacturers. If anyone could talk a little bit about how they've been coming alongside you and how you've been engaging them to understand the asset that you are to your community because of your partnership. Okay, Jim?
This is something it's a longitudinal process. We meet fairly regularly with our local school districts. We meet with our county government on a semi-annual basis. Really, it's just keeping them informed of what's going on in the healthcare system. We centered around a common challenge for us in our communities, such as behavioral health. So between the FQHC, the hospital, the county, the school system, we've come together to collaborate on projects together to address, for example, the adolescent behavioral health challenges, the adult behavioral health challenges. That years of collaboration with each other actually prompted the county to actually fund and stand up a crisis center in the county. Recognizing what the stresses were for the hospital, what the stressors were for the community health center. So I think, one of the real things we're proud of, that it's not something that happens overnight, but it's something where you keep them engaged and keep them at the table and find some common ground, that no matter what individual issues might be, no one can argue that the topic on the table is something that is really facing the community, and that we all have a piece of it that we can maybe address. So it's really fostering those relationships. And the other thing we've done is keep our hands in a lot of the community groups, be it the chamber, be it workforce development, workforce alliance, whatever those community organizations are. Getting membership on those keeps the hospital and the healthcare system voice out there, so that people understand what the real challenges are, because I've found by and large people don't understand the challenges facing our healthcare systems. You got to meet these folks on their terms, on their ground, to communicate the message. When there's crisis, that's not the time to get there.